2020. Pharmacist, regulatory consultant, therapeutic products branch at the Health Science Authority. Professor Yolanda Robles, who is president of the Federation of Asian Pharmaceutical Associations. Joshua Nikom, who is the senior vice president of public health at Swipe RX, and Dr. Deepa Maharaj, who is from our colleagues at APSMI and heading the working group on e-labeling. So I will now hand over to Mark Wong for a regulator's view. Thank you.
Okay, thank you, Greg. Thank you, organizers, for giving me the opportunity to present at this forum. Yeah, if I could see my slides here. Okay, so yeah, good afternoon, good morning, everyone, and thanks for attending this session. I would think before we kickstart the conversation, I think we should have some common understanding and alignment on what we mean when we talk about e-labeling. Because if you talk to a doctor, a GP on the ground, or a pharmacist, even a regulatory personnel, or even people in the industry, if you tell them about e-labeling, they may give different answers on how they perceive it to be. So difference in perceptions would arise from how either EPI or electronic PI is presented, what kind of format it is. Is it in a PDF? Is it in a browser-friendly XML, HTML? How is it delivered to you? Is it through a QR code as per the title of this forum? Or, I mean, today it could be QR code, next time, depending, even if you see how technology advances, it could be something else. It could be a barcode, or it could even be a situation where you just need to take a photo of the product and get the information like just on the spot, just like that. And the other perception is, how do you actually use it, the information? Is it just a replacement of the traditional package insert, or can you actually do something further with that, like going beyond the API, whether in the form of an app, whether you can draw the data into patient medical records, how it can operate among different national healthcare ecosystems. And this is something that the future is looking at in terms of e-labeling. It's not just a replacement of the paper format anymore. So in Singapore's context, we are looking more in the scope of replacing the paper format. It will be electronic PI or EPI, which users can scan through a QR code, which is appended on the outer carton of the product. So this QR code will direct you to the EPI information, which is hosted at this moment is hosted on the company's platform itself. But we are constantly reviewing whether this is the most appropriate platform to use moving forward, if we should expand the scope of EPI. So why are we doing this? What's the benefits of e-labeling? The benefits are quite well recognized in terms of providing timely updates, particularly in safety, to put out information so that healthcare professionals get the latest information. And compared to the traditional paper, where the turnaround is quite slow, you need time to print, to proofread, and to finally actually publish the physical hard copies, by which time a few months will have elapsed, compared to, say, if you have it in the EPI format, it will take days, if not even real time, depending on how you actually format the EPI. The other benefit will be in terms of flexibility, and allows for some agility in terms of how companies navigate their regulatory submissions. So one example where I could cite is in which e-labeling was found to be quite pertinent and useful would be in the COVID pandemic situation. So with regard to the mRNA vaccines, where they needed to push out the products quite quickly in an emergency situation, there are situations where we need country-specific safety information for PIs, and companies will not wait, especially for a small country like Singapore, to have Singapore-specific paper insert. You need time to print it out and then put it in the product before they provide to our customers. So instead of doing that, e-labeling actually facilitated faster supply to the customers through this flexible process. So that's another advantage. The next, of course, would be in terms of environmental benefits, cost savings for industry. We're talking about saving like 10 pages of PI reduced to just one digital PDF or XML. I think that's something that's quite not arguable in terms of environmental benefits. And the next benefit, I would foresee is more what I call value-added services and more pertinent to our patient-centric discussion, which we'll talk about in this forum. So what I mean, I'm talking about things like other media forms beyond an EPI, like a video to show patients how to actually use a product, educational materials, and so text-to-speech capabilities, other forms of dynamic content, which would definitely help, especially in the aging population like ours, where the elderly and seniors would need more help in understanding and comprehending patient information. So beyond our background on how we implemented e-labeling. So this started back in 2019. We did this in consultation industry. It's not something that we wanted to pushed out just like that. So we had some discussions and a draft guidance, which we put out, we circulated for consultation. We surveyed healthcare professionals to see what their thoughts on, what they feel about e-labeling. And throughout the process, eventually we came up, we finalized the guidance and published it in 2021. And the full guidance is actually out on our HSA website. And since then, we've had about 700 or so products which have implemented e-labeling. And we are looking into expanding the scope into the non-prescription space. But at this point in time, we are focused more on the prescription-only medicines. So because of the approach we took in terms of having the companies take the responsibility of posting the information themselves, we had to issue some form of guidance in order for industry to comply with the necessary requirements should they decide to host the EPI. Some of the key points that we look out for as regulators is to ensure that API is accessible 24/7. There should be contingency plans in the event of any downtime or outages. And there should be backup plans in the event that there should be a patient does require a hard copy for whatever reason. The company should be on hand to be able to deliver the physical copy. The next requirement that we ask of companies is to have, should they have a QR code, is to have a direct link to the EPI itself, at least minimum one or two clicks, other than having them to navigate through a confusing landing page, where it's usually mixed with other content which are not relevant to the product. So we want patients to get the information quickly as soon as they can without having to go through any form of scrolling or navigation. So that's the other requirement that we expect in order to publish EPI. We also don't allow any form of promotional content, and this is covered under our legislations in terms of advertisements and false or misleading information on products. We also do not want companies to request users to provide any form of personal data, as the name or email addresses, before they can access the EPI. So it's quite clean. Once you scan one or two clicks, and you straight away you get the info. And of course, most importantly, the EPI that is published has to be consistent in terms of the content to what is actually approved by HSA, so that information is, of course, accurate at that point of access of EPI. So from our experience these few years, we picked up a few learning points and challenges. And initially, when we rolled it out, we were thinking, because it's an electronic form, there are two things you need. One is a mobile device. Second is internet connection. And do healthcare professionals or patients have ready access to these two things should they want to access API? Because without it, there's no point. You can't access anything without an internet connection or having a mobile device. So thankfully for Singapore, because we're quite a small country, well urbanized, we don't have internet black holes where people have shortages or connection issues. And we generally don't have an issue at the moment in terms of connectivity patients who have access to QR codes. They are well, I would say, well trained in learning how to use QR codes based on our COVID experience. So in terms of the technical aspect, we don't expect there to be much problems for patients and healthcare professionals. Although I do appreciate that in other countries where there are rural areas which may not have access, this would be one of the main challenges in terms of implementing API for such countries. The next challenge will be from industry perspective. They would require some form of infrastructure, internal processes, resources to build the API and have it on their website to ensure that it meets all the necessary requirements. So from our experience and feedback with the industry, this is one of the main pain points that we learned from industry in terms of cost, setting up, which is why, although we have 700 products, this comes from only a minority of the companies. Less than 10% of all the product registrants do have e-labeling. But reassuringly, these are not just the major players like MNCs. We do have smaller companies who are on board as well. So at least it gives us some comfort knowing that it's not something that only the big players can afford to implement. Okay, the next challenge would be more on the because PDF as it is at least for us currently, it's unstructured data. So if you want to do further with the information, there's nothing much you can do with a PDF. And ideally, we should have, we're exploring ways to venture into structured data, which is what EMA and FDA are doing at the moment in terms of data standards. And this is something that we are exploring at the moment. The other challenge that we hear about is because different countries have different regulations, and for small countries like Singapore, we typically do not have a product that's specifically sold to Singapore alone. It may come in what they call an export bag. So this export bag is provided to, let's say, Singapore, Thailand, Malaysia. And if each country has its own requirements, let's say Thailand doesn't require e-labeling or Malaysia wants e-labeling and they have that QR code. So what are we going to do for the Singapore product? Are we going to have 2 or 3 QR codes? Are they going to put the paper in or they take the paper out? So these are some of the concerns that we hear from industry. And we are looking to see how to further circumvent such situations. Of course, structured data, this comes with opportunity in terms of whether we can really look into revamping the whole data, the presentation of the API. Of course, this involves not just effort on the regulatory end, but also in consultation industry with healthcare professionals, with the clinical community basically on the ground who are looking at national healthcare systems in order to fully optimize and reap the full benefits of API. So just to top that off, I'll just give a brief description of what we are doing currently. It will be the OTC pilot. So currently we are doing it for prescription-only medicines, but we have embarked on a pilot for over-the-counter medicines. This will be sold off the shelf or through the pharmacist. And in terms of the requirements and the processes, it's modeled after what we've done for QM with some slight differences. So the first difference is that this will only apply for products where they have the patient information leaflet in place, meaning the information is written in a way that's easily understood by the layman. So it's not some technical jargon that you will see for QM. And the first requirement is that it needs to be comprehensible to the patient. Second requirement is that, of course, we are aware that there may be patients who, for some reason, do not use mobile devices, do not know how to scan QR codes, or don't even want to scan the QR code, even if they have the means to do so. We have required that these products insert what we call minimum safety information on the outer carton. So it's like bite-sized info on the carton so that it's there to inform patients on most critical things they need to know, such as drug interactions, pregnancy warnings, how much to take, or what to do in the event of overdose. And these are usually for very established products. So we can be assured that at least there's some safeguards and guardrails in place, even if the patient decides that, okay, I don't want to scan, I just want to take the medicine. So that's one of the things that we considered as well. And during this pilot, we'll be monitoring. We have a feedback mechanism for industry to come back to us should they have encountered a situation where patient finds it difficult to access the code, or if they feel that accessing full information is not enough, or they actually ask for the paper insert instead of the API. Yeah, so that's work in progress, and at this point, I'm unable to comment too much on whether it's successful or not, but we look forward to a successful pilot. And on that note, that's all I have. Thank you.
Mark, thank you very much. Very, very interesting developments from Singapore, and just noting a few things there. Indeed, yeah, very important that both the healthcare professionals and the individual have the connection and have the mobile ability. But as you're saying, in Singapore, that's pretty well established. Interesting your comment about from COVID, how people are probably much more savvy than they were before about these things. And yeah, really obviously welcome the OTC pilot. And I like your statement. No technical jargon, has to be comprehensible for the individual. Great, thanks very much. Look, I'll move on now to Professor Yolanda Robles, then from a pharmacist point of view. Thank you.
So good morning to you, and also good afternoon to my Asian colleagues. So I will be speaking on the pharmacist's role in enhancing health literacy through e-labeling. So if I just wanted to recall some important information about pharmacists and pharmacies. We know that they are convenient and available in many places, and in most countries, no appointment is needed for consultation. They are also cost-effective, as most services are free, except perhaps for services that will require the use of devices for which the patient has to pay. They're also trusted health advisors for OTC, because they can provide recommendations for minor illnesses and other medications. And they also help bridge healthcare gaps where doctors and other health professionals are lacking. So the key roles in health literacy includes the following. I'll just go through them, but actually this is not the summary of all that pharmacists can contribute along this area. One is we could help identify patients who need more health information. And I have observed that when we have patients who are newly diagnosed, they need more information. If they're starting on a new regimen, new medicines, they have to have more information, especially on their proper use, the adverse effects, the side effects that they have to be meeting as they use the medication. And they also can provide appropriate patient guidance on how to access and use e-labels. Now that they are already started to use, the companies are already using e-labels, then perhaps the pharmacist, when giving or dispensing the medicines, can provide the QR code or the link, where the complete information about particular medicines available, and it could be for prescription medicines, over-the-counter medicines, and also health supplements. And also, pharmacists can help communicate risk about medicines, and we will follow the guidelines on e-labeling. So more or less, prior to the access of the patient of the information on the e-label, we can be able to give them some brief orientation wherein the details will be found in the e-label. Okay, next, we have the provision of telepharmacy and the use of the digital technology in drug information. And this was clearly shown during the COVID-19 pandemic, because there are services that were started even in my country, the Philippines, and in other Asian countries. So it becomes very easy to utilize the technology in providing information, especially when people are so concerned about wellness, self-medication, when they cannot access hospital and other health facilities. They are they can easily go to the pharmacy and ask for this information. And we also make telepharmacy available through the social media. And they can ask their questions, and they will be able to answer them through the proper channel. So it could be email, it could be through the social messaging apps. And then the involvement in various advocacies. How is this related to health literacy? Because so many people, the general public, are not so acquainted or familiar with benefits smoking cessation, how to take care of their heart and vascular health, also address the issue of adherence, antimicrobial stewardship for the use of antibiotics, drug information service, mental health, and others. So through these advocacies, we can provide the e-labels or links or QR codes to various individuals so that they themselves can know more about the different aspects of health and also medicines. And we can also be involved in patient education on vaccination. And this happened during the pandemic where we have to address the problem of vaccine hesitancy. We have a lot of both the distribution of infographics. We also be able to through the telepharmacy address this aspect. Okay, so but you see, the utilization of e-labels and also so that we could assure the benefits of this tool, we need also the universal healthcare. Its emphasis on primary healthcare really are very important, as well as self-care. These are important components which could be addressed, and therefore e-labeling would be very useful. And in Asia, and it was already mentioned by my colleagues, there is the use of affordable digital gadgets and access to social media. There is a robust digital environment which increased health technology utilization. So even places which before were not able to watch videos on medicines and other topics are now able to do it. Maybe there is some problem with the internet, but somehow if we take a look at the general consumption of digital technology, this is increasing. Now, professional organizations also have initiatives directed at public health issues. So this is helping because this becomes an area where fellow or colleagues, the pharmacists, for example, they become more concerned with the public health issues. And right now, many are into health promotion and wellness promotion. There are also pharmacy-initiated interventions during the pandemic. So there were uh, the patients who are needing information on how to uh, increase their immune or to improve, strengthen their immune system. So we are able to do it, and therefore, again, e-labeling would be useful because that will be also a source where they can access the information right at the comfort of their homes. And there is also this awakening of the population regarding health issues, and that's the positive side of the pandemic because people become more aware of and even practice hygiene, access to online health websites and resources, and the use of various agents to boost immune system. Now, in addition to enablers, there are also challenges, and I'm referring specifically to the Asia Pacific. There are barriers that were also encountered, and right now, these are realities in the implementation of relabeling. One is the cultural and language diversity. So, in terms of the language to be used, it has to be it has to take into consideration the common language used in a particular country because we are too diverse in Asia in terms of our culture and also in language. There is also an economic divide among countries. There are those with limited resources, and therefore, perhaps this technology can only be implemented on a staggered basis. There are varied structures as well of health and pharmaceutical systems, and this might also be a factor in the implementation. of technology, inadequate health professional ratio to population. So this is one concern. There should be we should, I mean, every health profession should be aware of the adequacy of the human resources to be able to provide the services. Another is limited English proficiency, but I'm on the positive side. I see that this is also increasing where more people in different countries can speak English. Another is the motivation of health professionals to educate patients. So this is an internal factor among different health professions that we need to address as leaders in pharmacy organizations. And the other is the technical preparation for the media or e-health literacy among disadvantaged groups. So these are the special groups like indigenous people who might also be helped, but again, there is we need to be able to introduce the basic before they can use the advanced technology. And last, I think I have my last slide after this. And this is just, I am with our fellow speakers here that I believe in the benefits of e-labeling. So I don't need to read everything. I do see the importance of e-labeling to improve patient safety and trust in medicines. And also, it enhances the user's experience regarding product information in a more user-friendly manner. So I hope that in the future we will have we can connect all of this development, digital development, and in the mainstream healthcare so that more and more people will benefit from this advancement. Thank you.
Thank you so much, Yolanda. And yeah, just picking up on a few of the points that you said there. For example, the importance of being able to have the language issue, multiple languages. That's very important because obviously in countries in which there are various different languages being spoken, that's really important that can be addressed. And we know that also in other parts of the world as well, that's important. And by the way, you mentioned a number of issues there about the need of greater understanding of individuals. You mentioned, for example, smoking cessation, an important role that pharmacists will have in areas like that. And we're actually coming up to what's called the NCD the UN high-level resolution on NCDs, of which tobacco cessation is very important. I mean, there needs to be greater understanding, I think, of the role of health literacy, e-labeling, the role of pharmacists, I think, in the whole of that area. So thank you very much, Yolanda. I move on then to Jocelyn. Necom, the floor is yours. Thank you.
Thank you so much. It's my pleasure to be with all of you today, discussing the potential for e-labeling and other aspects of technology to facilitate appropriate self-care in Asia Pacific. I work at CyberX, which is the largest digital network of community pharmacy professionals across 6 markets in Southeast Asia, including Vietnam, where I'm based. We launched in 2017, and since then we have grown. We now have over 310,000 app users. 77% of our users are women, and our users are working out of more than 55,000 community pharmacies across Southeast Asia. 4 out of 10 of our users are in rural areas, so we are very much nationwide in our coverage across the channel. And the reason that we've grown so quickly relates to self-care, and I'm going to talk about that in a moment, but also relates to the fact that we are a free access, multifunctional platform. So we are the largest free source of multiple benefits for pharmacy professionals. And as Yolanda has nicely outlined, and I think many of us joining today understand, pharmacists and other pharmacy and drugstore staff in Southeast Asia and other parts of Asia Pacific are serving as frontline health workers, right? They are providing primary care, and they are a primary source of self-care products and advice. So through our platform, we are enabling them to connect with each other through the largest digital community of practice. We are enabling them to access pharmacy-specific and industry updates, as well as Ministry of Health guidelines related to self-care products and other SKUs relevant to their businesses and the care they provide for their clients. We are also the largest provider of digital online professional education. And I'm going to talk about how we're leveraging that to contribute to the global and regional self-care objectives and priorities. In Indonesia, we offer an e-commerce function integrated into our app, so pharmacies can source products and supplies for the best prices and terms through our app as well. And we offer a range of practical tools related to the efficiency and the effectiveness of services that they provide and their operational aspects of their business. So this is a little bit about our app, and we have been supported by a range of industry and consumer health manufacturers, and in some cases, their distributors. We also, next slide, are partnering with global health leaders and funders to leverage our network to support self-care priorities and other aspects of community health. So I'm going to talk about a couple of case studies. Next slide. But first, just want to emphasize that the professional associations are our primary partners, together with ministries of health, to ensure that whatever we offer through our platform to community pharmacy professionals related to self-care, whether that's professional education, courses online, or other information and tools related to self-care, that we are doing so in accordance with the national guidelines. And we have found, as I think other speakers today will emphasize, that a supportive policy context, both in terms of e-labeling and other digital solutions relevant to self-care, is very, very important. So these are our primary partners, and without their support, the results that we have achieved so far and what we aim to do in the future would not be possible. Next slide, please. So I'm going to talk about two ways that we are contributing to the self-care agenda using technology and using our app and partnerships. The first is making it possible to scale capacity building, right? So my colleagues and the other panelists have emphasized the innovations that are possible through e-labeling to support self-care. One of the challenges that we are helping to address at our company is how can we quickly raise awareness through a very fragmented pharmacy channel, right, about new self-care products or about how to appropriately provide and counsel about appropriate use of those products to their clients, right? With so many independent pharmacies operating across Asia Pacific, the challenge of introducing new self-care products or promoting appropriate stocking, dispensing, and advising practices among thousands of independent community pharmacists is quite daunting, right? Very few partners, and certainly ministries of health, do not have the resources and the time needed to do that offline. So through our platform, we're able to help partners do this very quickly. And I think this is a theme that's emerging from today's panel, right? The benefits of technology in terms of speed and value, and certainly our experience in the digital professional education space highlights those themes as well. As you can see in this slide, since 2018, we've seen a 755% increase in the number of pharmacists that we have been able to train about self-care and other topics each year across 6 markets in Southeast Asia. Just last year alone, we trained more than 35,000 pharmacy professionals in these critical topics, including self-care. So really good scale for a limited amount, for a reasonable, modest cost and time, thanks to technology. We cover almost 400 different course topics, including self-testing for a variety of different illnesses, over-the-counter self-management products, and self-use contraceptives. 77% of all pharmacy professionals trained in self-care through our platform are women. So we are certainly addressing some of the gendered barriers to skill building and confidence building in terms of offering quality self-care through community pharmacies. And we are innovating in terms of pharmacy focused, but also a multi-tool approach to continuous capacity building, right? Just as none of us would expect a single offline training to change a pharmacist or any other healthcare providers' behavior overnight, we also recognize that online tools require multiple phases of engagement. And so we have developed a suite of training and post-training self-assessment, as well as external quality improvement tools that can be leveraged and scaled through our platform. So that's one area where we're adding value to the self-care agenda. And the second, if we can go on to the next slide, please, is relates to access to quality assured, affordable self-care products. So as I mentioned, in Indonesia, we have Belanja, which is the name of our e-commerce function, which is integrated into our app, and more than 10,000 retail pharmacies across the country are using SwiperX to procure self-care and other products through our app for the best cost and delivery terms. And our function is enabling these pharmacies to improve the availability, right? Expand the number of self-care products they're offering to their consumers. Also, to improve the affordability, we know through our bulk purchasing that we are able to reduce the prices to pharmacy clients. We're also reducing stock out rates as a result of our technology. So by digitizing the supply chain, we're creating benefits for pharmacy businesses, often operated by women, for their clients in terms of improved access to quality self-care and other products. And we're also addressing the intersection between climate change and health by motivating the use of green product sourcing and management practices as a result of our technology. I'm going to share two case studies very, very briefly that are relevant to these two areas. One, the first one, if we go to the next slide, relates to a specific example of how we're leveraging our technology to build pharmacists' motivation to provide appropriate advice related to self-care. This was a challenge that Dr. Yolanda highlighted a few minutes ago. So here's an example in the Philippines where we know that there are pharmacies are a major source of contraceptive self-care, and yet in many cases, pharmacists have not been trained to comply with national guidelines and offer client-centered, right? Again, sticking with this people-centered theme in terms of one of the most important benefits of self-care, client-centered counseling to help her choose the self-use or other contraceptive method that works the best for her. They haven't been trained because of the fragmented nature of the channel. And this is where our technology facilitates scale and overcomes that challenge, right? So this training and post-training digital engagement was designed to address a number of barriers. The first being that very few community pharmacists in the BARM region, where we focused for this initiative, one of the most rural and remote areas of the Philippines, had been trained in client-centered counseling for contraceptive self-care. But we also, and related to that, found that there were a number of pharmacist biases about self-care. And I think this is another area where technology can be extremely helpful, because even after we navigate the regulatory pathways for new self-care products, right? Even when the guidelines and the policies are aligned, even when we have a supportive market context, products are available and priced appropriately. If pharmacists and other healthcare workers who are the primary source of self-care products are being influenced by their own individual and in some cases professional biases, we may not be facilitating individuals to make the best choices for their own self-care. So in this particular example, there were a number of preconceived notions about what types of pharmacy clients should be able to use self-care contraceptive, with a particular bias against younger clients, unmarried clients, women who've never had been pregnant before, had a child. And so training, scaling training and related post-training capacity building tools was able to overcome those biases and help pharmacists understand that contraceptive self-care is something that pharmacists should equip their clients with advice, information, and products to make their own informed and voluntary decisions about, and not something that should be dictated based on any client's age, marital status, or parity. So you can see that the numbers in terms of the scale, in less than 5 months, almost 500 pharmacists in the most rural and remote part of the country were trained, and we had 10 out of 10 pre versus post training questions revealing a substantial improvement in knowledge and commitment to offer self-care counseling to encourage appropriate use of self-care contraception. So a great story about the scale that's possible and how technology can help address pharmacy bias related to self-care in the Philippines. The second case study, next slide please, relates to access. And this is an example from Vietnam, whereby we leveraged our technology to crowd quality assured self-testing products into the pharmacy channel. This data represents a partnership that we had with 2 manufacturers of self-use nasal self-use tests for COVID-19. We worked with manufacturers of tests that were both locally approved in Vietnam, but also met the global guidelines for quality assured self-testing. And at the time that we started this work, there was a lot of confusion in the market about which rapid tests are designed for self-use and which are designed for provider-assisted use at a health facility. And as many of you can remember, there was, I think this was a global area of confusion early on in the pandemic. So we were able to leverage our technology and quickly clarify, out of all the SKUs that suppliers are providing to you, these are the 2 that meet the quality guidelines for self-use, both locally and globally. And as a result of our digital engagement through our platform, we saw 92% of the SwiperX trained and engaged pharmacy professionals stocking the right tests, compared to only 29% of those that we did not train and engage through our platform. And we facilitated sales of over 17,000 units to community pharmacies across 2 cities and 1 rural province in less than 10 months. So really strong results in a short amount of time. And I should highlight that these SKUs were higher priced than the lower quality and non-approved self-use tests, which were being inappropriately marketed for self-use. So I think this is another area where, as self-care expands, it's really important to equip pharmacists and other community and facility-based health workers with the knowledge, the training, and the confidence that they need to promote quality assured self-care products and the appropriate use of those products. I think 1 slide left just to highlight a few key takeaways from our perspective as a technology company committed to expanding self-care through community pharmacies with our technology and in partnerships with both industry and global health partners. We see great opportunity for more transparent and streamlined regulatory pathways for new self-care products. We see a huge opportunity for greater policy support for community pharmacies as self-care agents, right? Really important to recognize that pharmacies are already supplying the bulk of self-care products, whether that's OTC medication for self-management of relatively straightforward and common health issues, or whether that's self-testing or whether that's self-use contraceptive. But greater policy support can really make a difference. And last but not least, financial support, both from industry or global health partners, is needed to scale innovative models, including the 2 that I've just highlighted through our case studies. But I think it's important to recognize that because this is a new and very quickly evolving area, there's a need both to test and try and scale some of the more innovative models to provide value, to provide convenience, and put healthcare into the hands of the individuals who need it. Thank you so much.
Well, thank you so much. I have to say, I find that very overwhelming. There was, you're doing so much, and I think it shows. We in Geneva yesterday, the day before, we held a session with Be Healthy, Be Mobile, which is a WHO initiative. We were talking about the interface of digital technologies and self-care. And basically, I mean, when I listen to what you're providing, it really is that if you add digital plus self-care, we're heading into a healthcare revolution, really. We're going places which haven't been done before, and we're empowering people way beyond what's ever been done in healthcare. And I think, you're a company, and I think it shows also the amazing impact that the private sector and innovation and entrepreneurial thinking brings to all of this healthcare sector. So there's many parts of this revolution, but the digital one is really, I think, expresses where it is, and you're covering all the areas from the regulators to the pharmacists to the individual. So thank you very much for that. We'll come back, I'm sure, on the discussions. So I'm now going to hand over to Deepa Maharaj, and the floor is yours from the perspective of our colleagues at APSMI.
Thank you, Greg. And hello and good afternoon, good morning to everyone here. What a pleasure to be part of such an esteemed panel and really listening to the passion that everyone has for e-labeling and really the consumer at the heart of everything. So that is absolutely wonderful. So my great pleasure today is really to share with you what APSMI's role has been on the e-labeling digital revolution. And key to note that we start off with knowing that the digital health disruption is now. We heard that the COVID pandemic had really forced us into a tech shift, and e-labeling became part of that. However, this is such a big public health enabler, yet our labels are not very user-friendly. And if you look at it, 88% of APAC consumers have a smartphone. Many have two. Yet 70% of the e-labeling in our region is not a patient-centric e-label. Many are words of paper in a PDF format with very, very small text. From an environmental and economic cost perspective, going without e-labels is unsustainable because last year alone, 500 million paper leaflets were produced in APAC, of which 25,000 trees were cut down to produce. And finally, we could have saved over 30 to 50 million US dollars annually and reinvested that into healthcare systems. So it just shows you the importance of such an important topic. Also, OTC access is being lagged behind. And we heard from SwipeRx, we heard from Yolanda, the importance of being able to give self-care solutions quickly and easily to patients. And e-labeling is such an unlock for this. And finally, we all know that currently, the fragmented process of our regulatory systems is not really helping. We have many countries that are spearheading e-labeling. We've heard from Singapore, Mark and team took a really courageous step to partner with industry on OTC e-labeling. But again, there are many challenges and a long road to success. Australia, one great example of where e-labeling has been very successful. And we have many APAC pilots, so many regulators are putting their hands up in this area. For this, APSMI stood up, and we really wanted to take a charge on this for APAC because we owe it to our consumers. So I'd love to share with you a quick video of the 2 position papers that we prepared last year and that we are championing across the region. If you can play the next slide. I think we're missing the volume. So this is literally the one key e-labeling position paper, which I will take you through as we go through. And maybe we stop there and move to the next slide. And this will be available to you. It's really showcases the journey that APSMI has gone on to recognize the importance of advancing e-labeling. And our position papers are available on our website, so you can easily access it to support your strategic advocacy journey to make sure that you're able to introduce this critical element into your countries, as well as sensitize and socialize your HCPs around it. So our advancing e-labeling position paper really focuses on three things. We really wanted to map what the current regulatory landscape is. And you will see clearly on a map itself that we were able to showcase the regulatory countries that are far advanced in e-labeling and those that are really putting their hand up to drive critical pilots. We identified what were the regional challenges and opportunities, and my esteemed panel speakers have really outlined most of it. And finally, we put together an actionable advocacy roadmap that we are championing this year across all of our key jurisdictions and regions. If we move to the next slide. And this is literally what our position paper summarizes in terms of the e-labeling landscape as of the end of 2024. And you can see that the maturity level of the APAC region really goes from those that are in preparation, those where e-labeling has become the center and cornerstone of driving some of the regulatory reforms, and the others where they are completely advanced. So if you take, for example, in preparation where India is still in the planning phase, Philippines looking at driving pilots for OTC, whereas you have Singapore and many other countries like Indonesia that are looking at really advancing in this because they've already started pilots and they're now on the journey of finding those solutions to unlock. Whereas then you have Australia, you have South Korea that are so well advanced, and this has become the cornerstone of what patients are using daily to deliver and gain their self-care education and health literacy. So critical enabler, yet maturity is really fast across our region. If we move to the next slide. If you look at what the main challenges and opportunities specifically that we looked at and that APAC region was experiencing as at end of 2024, there were three buckets that we looked at. One was access. So there was really limited product information. And if we look at it, as someone mentioned in the comments, how do we really get real-time safety data in the hands of the patient and their healthcare professionals so they can make the best decision for their patient? That is really limited right now. And that's many reasons. Firstly, because of phasing about the supply chain. There are not enough contingency plans to be able to ensure that we can drive real-time access to information. Then adoption. Because of patient centricity and lack of digital literacy, and Yolanda really nicely touched on this, we are seeing that this is not an initiative that is being really vastly driven by health authorities. However, opportunities exist because digital health literacy is really on the rise, and there are strategies in place to make sure that governments can equip themselves because patients are demanding it now. They can be standardized patient-centric formats, and we've seen many examples where Australia has introduced very simple formats that can be easily accessible and patients can access real-time education about their products. And finally, a key gatekeeper is the pharmacist and the HCP. Without them, and without them being able to help consumers navigate this space, they will not be able to have credible information to best use their products. And finally, there are dual systems, and I'm sure you've all seen it. We have the hybrid, we have the fully implemented, and we have those that are not even implemented. And I'm talking about where we have both the package insert or the patient information leaflet in a hard copy format, as well as an electronic PDF that's available. And those systems really make things very complex and fragmented. And honestly, the opportunity is for us to really move to abolish paper label leaflets and really go completely e-label, where the patient has a user-friendly format to be able to access their information. And if we move to my last slide and really the concluding slide, and what are our recommendations coming from this, and happy to take questions if you want. I'm really cutting this short in the interest of time, but we really have a call to action to say that we need an APAC e-labeling regulatory framework and digital health literacy guideline. We are working very closely with the Self-Carer Network to be able to introduce this as one of the key working groups. And it has been adopted at the last meeting that we had in April. And looking forward to coming up with some really harmonized guidelines that regulators from various countries can use to shape their frameworks for e-labeling. We also want a multi-stakeholder e-labeling coalition, and this is not a job for regulators and industry alone. It is important for patients, for digital service providers like SwipeRx, like others in the industry, as well as for HCPs to come together to work on this, to be able to find a framework that is workable for the patient. And finally, to implement complementary patient-centric initiatives that can help us facilitate the patient experience, but also allow for higher stakeholder involvement. And a platform like Self-Carer is really one of those that will ensure that we're able to do this. So I'd like to end there. That is really our call to action. And I really hope that you all join hands with us to be able to deliver this in the future. Thanks, Greg.
Yeah, Deepa, thank you so much. And I'm just putting up on the screen what I have for my antihistamine. So if we could all work to save the planet and to make things easier and accessible for everybody, it's a great partnership to work on. I know we're restricted for time. I was going to, I don't want to repeat what Deepa said, but that call to action is really very important. And if we could all unite behind that as industry, regulators, healthcare professionals, and basically digital providers, I think we could make a substantial move in progress for health delivery for individuals in the region. And I think, to be honest, what you can do in the region, and has been said many times, very social media and digital savvy region, we can learn a lot from the rest of the world. Look, we're limited in time. I know there has been some questions put on the chat. I think if I've got this right, Mark has been asked something. Mark may want to reply to that, and then I'll take just a couple of other questions before we finish at 10 past the hour.
Okay, I noted a comment on having, in case of any serious safety alerts, and I already had a reply in Q&A, and I agree with the person who wrote the comment that this is one of the potential use cases for API, and definitely this is something that businesses and industries should consider in terms of ensuring the safety of patients. Yeah, so that's it. Thanks.
Okay, Mark, I have a question for yourself. This distinction, and maybe others can mention it, distinction between e-labeling and information, simple information, between like prescription drugs and OTC drugs. How do you see that going forward? And do you see in the long term that there's going to be a phase out of paper, that we are at one point going to go, totally electronic? Do you see a vision of that? And how do you see that is, important from a regulatory point of view? Yeah.
Okay, in terms of phasing out paper, at the moment we leave it voluntary to companies. I mean, if they see it in their strategy, they feel that it's their business interest to go paperless, and then by all means they can do so. And so far for the past few years, we've been allowing that. But those are really making it mandatory for them to phase out paper at this point in time, because we are aware of the challenges that businesses face, and it's not a really seamless process of implementing e-labeling. So we are giving them some time to really figure out how to get used to the systems. And I also understand that in certain, even the larger agencies like EMA, FDA, because its paper is hard-coded in their legislation, they still require companies to have the paper in their boxes. So whether or not that really makes a difference in our environmental impact, even if Singapore goes ahead and say, okay, no paper, there's just like 5-6 million of us compared to the bigger countries, whether that really makes a big impact in terms of environment concerns. But yes, we, as in Asia, of course, if we are able to advance this and let others know that this is what we're going here, I think we share opportunities and learning experiences. I think this would be something that at least there's hope in terms of the environmental concerns. Yeah. Thanks.
Okay. Yeah, Deepa, I wanted to write them down, but do you recall the figures you said of the numbers of trees that were cut down and the amount of people?
25,000.
Quite impressive
Yeah.
figures and the amount
Very,
of
yeah.
reduced. Yeah. I don't think there's anything else on the chat that I'm aware of. If one of my colleagues tell me, but Yolanda, what do you think? You know, you're at the you're right at the end. At the end, it's not the end. You're on the interface is what I want. You know, with the individuals, with consumers and patients. Yeah, individuals, people like ourselves. Yeah, that come into your pharmacy. What do you think their feeling is? I mean, is there a difference in age groups between maybe moving e-labeling or not moving e-labeling? How do you think your customers, if I can use that word, are seeing this?
So, if we're looking at the age composition of Filipino pharmacists, many of them are young and they are digitally, educated, and so I don't see this as something as I think e-labeling is something that they will find exciting and something which they could easily teach patient to use. And for a long time, pharmacies have been using digital technology in inventory management. But this is only in the recent years that we are looking at it more from the point of view of providing drug information, because I used to my area is in medication counseling, so it's like I am quite dependent on databases that should be available to me. And then, but you see, with the labeling, it's like we're empowering patients to also do something about it and get the information on their own. But as pharmacists, we are there to help them navigate it. Like if they have questions and they need extra explanation, then should be ready to provide it. So I would say that really we have, I think, as long as we provide the proper training, regarding e-labeling, I think many pharmacies should be interested to be using and their counseling, using this in their counseling.
Okay, yeah. I'm just reminding everybody that our position papers, I think, have been circulated on the chat, so they are available for you to look at. I have to say, one of the things that I would love to see, just as an individual, is, and I was sorry, it wasn't my antihistamine. This is just for paracetamol, yeah. So I mean, I would love to see just greater use of symbols. You know, for us to have simple leaflets, not leaflets, but even leaflets or e-labeling, but with more use of symbols, and maybe looking at international symbols that everyone can see, because sometimes you just struggle to find what dose you're supposed to say, and unless the pharmacist helps you in doing it. Anyway, I don't want to go on. I just want to ask Jocelyn, maybe we've got to wind up, but yeah, your company is just covering every aspect of what's possible. But tell me, where do you think, looking, I don't want to look too far backwards, but there must have been a massive acceleration at one point in all of this. And where have you seen that over the last years, and why do you think that's happened? And then taking what's happened in those last years, where do you see us going forward in the next 5? I mean, are we on the cusp of a revolution here?
I think absolutely. And it is true, as you and other panelists have alluded to, that the pandemic, perhaps this was, it's hard to think of any silver lining related to that experience, but certainly it did propel all of us, right, as individual consumers of healthcare and providers at different levels in health markets and health systems across Asia Pacific and globally, to become more digitally savvy. I think your previous question about, is this, our digital solutions for all is a good one, and we need to continue to be thoughtful about that. I know in my experience, my parents have a really hard time. My teenagers, no problem. So there definitely are some age and perhaps other access barriers that we need to be cognizant of. And we know in our platform that we have, pharmacy professionals of all ages. And I mentioned from our case study in the Philippines, even in the most remote and rural areas, benefiting from technology assisted solutions to facilitating self-care. So I think that's important. And I definitely think, the trajectory, this has taken off. And it's, at this point, it's about, working together to think about how to optimize access responsibly. One of the things that I think is important for all of us to emphasize on today's panel is that self-care does not mean that individuals take care of their health completely independently, right? It's always within the construct of connecting them to keeping them connected, and in some cases, pulling them even more into health systems, right? Self-care and e-labeling can be about helping her make an informed decision about her self-medication with and increasing the likelihood that she will see a doctor when she needs to, right? So, and your, I think, point about making sure that e-labels are as text light as possible, as clear and simple and even visual is a great one. A great specific example of how we could do that together. So definitely lots to learn, but we are climbing. The question is just how quickly. And I think, that this panel highlights all the different actors, from the regulatory to the policymakers to the tech and the health system providers, right? And of course, a variety of industry and global health partners. So I'm so grateful that you've pulled this together. It's really wonderful. Hope we'll see more conversations like this in the future.
Well, thank you. And look, we as Global Self-Care Federation, we have put e-labeling at the heart of what we want to do. I think it's also the heart of the future of health literacy. But, as I heard yesterday, we're going to wind up now. I heard yesterday, health starts with the individual and with the community, but is what you've just said, Justin, and what other people are saying is indeed, it's about empowering people, and technology is going to empower people, to help them self-care, to use the OTC products that we have, or pharmacist-based products we have, to the best abilities they can. And indeed, it also, fills up the primary healthcare system in other areas. So this is great. So e-labeling, we'll leave it there. It's the future. Thank you everybody for attending. I think we reached nearly 90. I thank my panelists. I also want to thank the team at Global Self-Care Federation, Padma and Aoife, for putting this all together. Everybody have a good evening or good night or the rest of an afternoon, wherever you are. Thank you very much. Yeah. Bye-bye.
Thanks, everyone. Bye.
Hi, thank you.
Thank you.
Bye.